What is metoprolol? Metoprolol is a beta blocker that affects the heart and circulation, blood flow through arteries and veins. Metoprolol is used to treat angina, chest pain, and hypertension, high blood pressure. Metoprolol is also used to lower your risk of death or needing to be hospitalized for heart failure. Metoprolol injection is used during the early phase of a heart attack to lower the risk of death. Warnings: you should not use metoprolol if you have a serious heart problem, heart block, sick sinus syndrome, slow heart rate, severe circulation problems, severe heart failure, or a history of slow heartbeats that caused fainting. Before taking this medicine, you should not use this medicine if you are allergic to metoprolol, or other beta blockers, atenolol, carvedilol, labetalol, nadolol, nebivolol, propranolol, sotalol, and others, or if you have a serious heart problem such as heart block, sick sinus syndrome, or slow heart rate, severe circulation problems, severe heart failure that required you to be in the hospital, or a history of slow heartbeats that have caused you to faint. To make sure this medicine is safe for you, tell your doctor if you have asthma, chronic obstructive pulmonary disease, COPD, sleep apnea, or other breathing disorder. Diabetes. Taking metoprolol may make it harder for you to tell when you have low blood sugar. Liver disease, congestive heart failure, problems with circulation, such as Raynaud's syndrome, a thyroid disorder, or pheochromocytoma, tumor of the adrenal gland. Do not give this medicine to a child without medical advice. Tell your doctor if you are pregnant or plan to become pregnant. It is not known whether metoprolol will harm an unborn baby. However, having high blood pressure during pregnancy may cause complications such as diabetes or eclampsia, dangerously high blood pressure that can lead to medical problems in both mother and baby. The benefit of treating hypertension may outweigh any risks to the baby. Ask a doctor before using this medicine if you are breastfeeding. Metoprolol can pass into breast milk and may cause dry skin, dry mouth, diarrhea, constipation, or slow heartbeats in your baby. How should I take metoprolol? Take metoprolol exactly as prescribed by your doctor. Follow all directions on your prescription label and read all medication guides or instruction sheets. Your doctor may occasionally change your dose. Metoprolol should be taken with a meal or just after a meal. Take the medicine at the same time each day. Swallow the capsule whole and do not crush, chew, break, or open it. A Toprol XL tablet can be divided in half if your doctor has told you to do so. Swallow the half tablet whole, without chewing or crushing. Measure liquid medicine carefully. Use the dosing syringe provided, or use a medicine dose measuring device, not a kitchen spoon. You will need frequent medical tests, and your blood pressure will need to be checked often. If you need surgery, tell the surgeon ahead of time that you are using this medicine. You should not stop using this medicine suddenly. Stopping suddenly may make your condition worse. If you have high blood pressure, keep using metoprolol even if you feel well. High blood pressure often has no symptoms. You may need to use this medicine for the rest of your life. Store at room temperature away from moisture and heat. Metoprolol injection is given as an infusion into a vein. A healthcare provider will give you this injection in a medical setting where your heart and blood pressure can be monitored. The injections are given for only a short time before switching you to the oral form of this medicine. Dosing information. Usual adult dose for hypertension. Metoprolol tartrate immediate release tablets. Initial dose, 100 mg orally per day in single or divided doses. Maintenance dose, 100 to 450 mg orally per day. Metoprolol succinate extended release tablets. Initial dose, 25 to 100 mg orally once a day. Maintenance dose, 100 to 400 mg orally once a day. Usual adult dose for angina pectoris. Initial dose, Metoprolol tartrate immediate release tablets, 50 mg orally twice a day. Metoprolol succinate extended release tablets, 100 mg orally once a day. Maintenance dose, 100 to 400 mg per day. Usual adult dose for myocardial infarction. Metoprolol tartrate. Early treatment. Initial dose, 5 mg for every 2 minutes as tolerated for 3 doses. Patients tolerant of full 4 dose, 15 mg, 50 mg orally every 6 hours starting 15 minutes after the last 4 dose and continued for 48 hours. Patients intolerant of full 4 dose, 15 mg, 25 or 50 mg orally every 6 hours depending on the degree of intolerance starting 15 minutes after the last 4 dose or as soon as their clinical condition allows. Late treatment. Maintenance dose, 100 mg orally twice a day. Usual adult dose for congestive heart failure. Metoprolol succinate extended release tablets. 25 mg orally once a day, 12.5 mg orally once a day in patients with more severe heart failure, double dose every 2 weeks to highest tolerated dose or up to 200 mg orally once a day. Usual pediatric dose for hypertension. Metoprolol succinate extended release tablets. 6 years or older. Initial dose, 1 mg/kg orally once a day, not to exceed 50 mg orally once a day. Maximum dose, 2 mg/kg, or 200 mg, orally once a day. What happens if I miss a dose? Skip the missed dose and use your next dose at the regular time. Do not use 2 doses at one time. What happens if I overdose? Seek emergency medical attention or call the poison helpline at 1-800-222-1222. What to avoid? Avoid driving or hazardous activity until you know how this medicine will affect you. Your reactions could be impaired. Drinking alcohol can increase certain side effects of this medicine. Metoprolol side effects. Get emergency medical help if you have signs of an allergic reaction to metoprolol, hives, difficulty breathing, swelling of your face, lips, tongue, or throat. Metoprolol may cause serious side effects. Call your doctor at once if you have very slow heartbeats, a lightheaded feeling, like you might pass out, shortness of breath, even with mild exertion, swelling, rapid weight gain, or cold feeling in your hands and feet. Common side effects of metoprolol may include dizziness, tired feeling, depression, confusion, memory problems, nightmares, trouble sleeping, diarrhea, mild itching or rash. This is not a complete list of side effects and others may occur. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA 1088. What other drugs will affect metoprolol? Tell your doctor about all your current medicines. Many drugs can interact with metoprolol, especially any other heart or blood pressure medications. Epinephrine, EpiPen. An antidepressant. An ergot medicine dihydroergotamine, ergonovine, ergotamine, methylergonovine, or an MAO inhibitor isocarboxazid, linezolid, phenelzine, rasagiline, selegiline, tranylcypromine. This video is not complete and many other drugs may interact with metoprolol. This includes prescription and over-the-counter medicines, vitamins, and herbal products.